Proceed.
Hello, I'm Dr. Akhtar, one of the doctor in the surgical unit. Am I speaking with Lucille Smith?
Yeah, doctor, I'm Lucille.
Okay, could you please confirm your age for me?
I'm 29.
Okay, so can I call you Smith?
Lucille is fine.
Okay, Lucille. So, Lucille, I do understand that you wanted to speak with one of the doctor because you have some concern. May I know that how can I help you?
Yeah, you tell me, doctor, why am I here? What am I doing here now?
Okay, listen, I can completely understand you are quite upset at the moment. It's completely understandable. As my understanding that you had a surgery and you have come back again because you have some infections. I do understand completely. So, in order to address your concern, can I have a chat with you?
Yeah, sure.
Okay. So, Lucille, could you please tell me what happened exactly when you why you are come back again?
Um, See, I had this surgery. There was like nothing. It wasn't even causing me any problems. But they said to remove it's a simple surgery and all that. But I went home, and then as like 5 days ago, I just started becoming all swelling and discharge from there, and just came to the hospital and they just admitted me. I mean, what is this, doctor?
Okay, I'm really sorry about your suffering. Actually, I've been very distressed because of this. So, may I know that was the surgery went everything fine?
Yeah, it was all fine. Just happened in one day, then sent me home.
Okay, and may I know that did anyone explain to you after discharge, while you discharge you, like how do you take care of your own?
Yeah, they said, but not like they didn't like even show me how to do it or anything like that.
Okay, I'm sorry to hear about this. And did you do the dressing regularly?
Yeah, I did. Every day I did.
Okay, so did you do it by yourself or someone else help you?
No, I only did.
Okay. And may I know that what sorts of treatment was given that time?
Nothing. I just got some painkillers. That's all.
Okay. And by any chance, is there any contamination of the wound with anything?
What does that mean?
Did you go to the sea or any sort of water contamination?
No, nothing like that. I was at home.
Okay, all right. And how are you feeling now?
I'm okay, but I'm very angry, doctor. Why did nobody tell me this could happen?
Okay. So, Lucille, I will definitely speak about this. Just please bear with me for a few minutes. Is it okay with you?
Yeah.
Okay. May I know that do you have any other long-term medical condition?
No, nothing.
Okay. And are you taking any medication?
No.
Okay. Are you allergic to any medication?
No, doctor.
Okay. And do you have any particular concern?
No, I want to know why nobody told me that this could happen. Wasn't this supposed to be explained before to me properly? Like it's such a pain I had to go through.
Okay. I can understand your worries. It's completely understandable. So let me
Hmm.
explain the things. Actually, Lucille, we're really sorry about this. This should have been explained to you earlier, like how to take care of the wound of when you have been discharged. So, because you mentioned that the surgery went well and it was totally fine. So,
Okay, but when I came here, they gave me antibiotics now. They could have just done that before, right?
yeah, let me explain the things from the beginning. So, first of all, I don't have enough information. You know, sometimes we are not sure about this, what is the causes of the infection. because sometimes some people are developing the infection without any reason, and it's very difficult to explain. And regarding the antibiotics,
Commonly,
we do you understand?
are you saying this happens very commonly?
Yes, you're right. No, it's not actually commonly happen. It's things like that. It's just a complication sometimes because we are not giving antibiotic routinely for all the surgery, and we only give the antibiotic if we just suspect that whether any chance of infections. Do you
I mean,
understand?
I get infection, right? Why didn't I get antibiotics? How did you not know that I'll get infection? How did you decide that?
Okay, I completely understand, Lucille, your concern. So,
And you
Lucille,
get infection now.
yeah, actually, from the information I have gathered, it doesn't seem like that you have any risk of infection at that time. And I'm really sorry, this should have been very explained to you very clearly. And at the moment, as I mentioned, that I don't have enough, I don't have any information regarding your.
Information. I just want to complain now. What can I do now?
Okay, Lucille, I completely understand your concern. We're sorry about this. So it's completely your right. You can make the formal complaint. There is an independent department that is called Patient Advisory Liaison Service. So I'll help you. You can make a formal complaint.
Okay, fine.
And
Yeah, I want to.
okay, Lucy. And Lucy, we are really sorry about this. You are going through all of this, but let me explain this. I'll definitely look in your notes, and we'll try to find out what's happening with what's happened with you, because sometimes the infection can develop without any specific reason. It's very difficult to explain the causes of infections, and we are not prescribing the antibiotic just to prevent that. Sometimes if we prescribed antibiotic unnecessarily, it can develop some resistance. Do you understand?
Yeah, fine.
Okay. Do you have any other concern?
What do I do now?
Okay. So, as you are having some antibiotics and we are treating you, so we'll regularly dressing your wound, and I think you're fine. So I'll speak with my senior, and I'll let you know and update the condition. And what can I do for you? I'll update you about the things. But in this meantime, if you have any sort of problem, just let me know.
Um, Thank you, doctor. That
Sir,
was
I
good.
messed up the things actually.
No, no, no. You covered most of the things. You got almost everything that I wanted to ask out of me. So that was at least that was good. So the examiner will tell you what. Uh, I don't think you missed much. I'll just
Thank
hand it.
you.
Hey, hi, Dr. Syed.
Hello, doctor.
All right, so that was great. That was a good try. But you understood that this was an angry patient, right? Have you encountered this case before?
Yeah, I go through the case, but the perform. This is the first time I perform this.
Oh, I see. Yeah, this is a little difficult to manage because this patient is already angry and she is irritated that she has to come in and get admitted for a surgery, which was apparently daycare. All right. So this is
Yeah,
actually indicating to one of our pillars of medical ethics. So technically, we are not supposed to do more harm, right?
yeah, yeah,
Like we are supposed to weighing the benefits and the harm. We are not supposed to be doing more harm, which in this case happened, right? So the couple of things. So usually this patient, they'll be very irritated. They'll be very annoyed. They'll be screaming at you. So you'll have to keep your calm and navigate through the important points. So most importantly, you have to highlight what is the issue. So issue, you very correctly recognized that there was an information gap. So she's also wondering that something as simple as a cyst removal has caused so much complications. I mean, it was always explained it was simple. Then why is it cause so much complications? So you know that there is some kind of a communication gap there. right? So address that. So definitely you asked about the surgery. Very good. You needed to know a little bit about the surgery and when the infection developed. She says, yeah, 3 days later, the infection developed, and I had to get hospitalized. So understand the degree of how bad that infection was. It's like, can you tell me a little bit about the infection? Like, was there discharge of pus? Was it swollen? Was it painful? So you're trying to assess how bad the situation was. Are you with me?
Okay. Yeah.
Yeah.
But so if patient simulator mentioned that he actually mentioned all these things in one go. So should I just again explore the things to know the
Whatever you
better?
whatever you need to say that it was really bad, to assess how bad the injury was. Sometimes they'll give you some of the information. For other things, you just have to ask, like, he said it got infected, but then you should have asked a little bit about, was there pus, were you in a lot of pain, did you have fever, because you want to know whether it went systemic as well, right? Like, how bad was it? Because quite frankly, once the issue has happened, like, she has developed infection and she hasn't been told, so you have to assess how bad the infection is, right? Because
Okay.
you did something, I mean, the team didn't do something and that has caused a harm. So you have to see how bad the harm is. Was it a systemic infection? Was it just localized, right? So get an idea of that, right? So then accordingly you will be saying that, I'm so sorry, I'm sorry, this shouldn't have happened, and I'm so sorry that you were not explained, this is not right from our part, like, then you can actually give in more sympathy, assessing how bad the situation is, number one. And then after that, to understand like where it went wrong, so you can ask little questions. Like, after you understand how bad the wound is, then you know that she's also on antibiotics, because that information is already given to you, right? So one thing that you needed to know was how severe the wound was, and now you know that she's on antibiotics. So then the next thing that you have to find out is, was she told anything about the complication? Because she seemed to be very startled by the fact that, why did she get this infection in the first place? And it was always going to be a simple procedure, right? So then you need to understand that communication gap. So then ask about, were you explained about the complications of the surgery? Were you explained about proper wound care, right? So wound care, she said
Yeah.
yes. Complications, I don't think you specifically asked that, but
Yeah, I missed
somewhat.
that.
Yeah. So that's what you need to understand, that where the communication gap happened, right? And
Yeah.
then the next thing you need to do is, you need to assess if she is low risk or high risk. Because if this was a patient who has cancer and has a low immunity having to undergo the same surgery, you would definitely give them antibiotics, right?
Yes.
Because she's a low risk case, you're not giving her antibiotics. That's what you were trying to tell her. So that's why you have to assess that low risk. So you have to ask the PMAFLOSA questions about past medical history, medications, which partially you did. But further on, you need to ask about nutrition, smoking, alcohol habits, any activity after the surgery. Was rest actually prescribed to you, right? Then you'll have a
Okay.
holistic idea of why the wound went bad, right? So once, because so one thing about angry patients are, they don't want to listen to justifications, they want you to do something, right? So from here you can understand what to do. So after asking all these PMAFTOSA questions, you realize that she doesn't have any risk factors. So bring that back in management. All right.
Mm-hmm.
And since
Yeah.
you are in the surgical unit and you have gone to see the patient, you should definitely do examination, isn't it?
Oh, yeah. Yeah, yeah. It's just a case of, yeah.
Exactly. You've gone to the ward to meet this patient and she has a wound. So at least check the vitals, general physical examination, examine the wound to see how bad it is, right? Ask her about her current condition right now. Like, how are you feeling right now? Are you in pain? Is there any more pus? All the things that she had come with, has it all resolved? That's what you're trying to see. And then after that, go into the explanation. Oh, one other thing is that, so since you know that this patient has had a lot of problems and she had to get readmitted, ask a little bit about the home situation. Like, she's in a lot of distress, right? Like, I mean, how are things at home? after discharge, is there somebody at home to take care of you? Just a little IPS building questions. So
Okay.
after that, when you're going into explanation, tell her that I'm so sorry, but surgery is one of the complications that should have been explained to you. When you were, I'm sorry, infection is one of the complications of the surgery, which should have been explained to you, and I'm so sorry that it was missed by our team. I will definitely look into that. And then go on to say that I will talk to my seniors, I'll talk to my colleagues to find out where it went wrong. Right? Because you are definitely, first of all, you're giving her an explanation, and also you're telling her what you can do to help her out. Because especially angry patients don't just leave it at explanation, because they'll just get mad, right? Because
Mm-hmm.
already they're sitting in the hospital, everybody just giving them explanations, right? She wants to know why something so grave happened to her, right? And the next thing about antibiotics. So the next thing is like, you're already pumping me full of antibiotics. Why didn't you give me antibiotics before, after I got discharged? So then ask her, just tell her that. So out of the conversation that we had, out of the questions that you've answered for me, I would categorize you as a low risk patient to develop this infection. And it's very unfortunate that you did develop it, but usually for low risk patients we don't give antibiotics, because that is not warranted. It's very very rare that this happens, and usually if you give antibiotics, it might cause resistance for bugs that can attack you in the future, so these antibiotics won't work, right? So then that's the correlation, that she's actually low risk, right? But then she'll still be mad, like, why didn't you find out if I was high risk or not, right? So then you can always get back to her saying that, how about I look into your notes and find out if there is any cause that would warrant antibiotics in your case, right? So you're saying that from the conversation it feels like you're low risk, but I'm not sure, let me just go and find out, right?
Yeah.
Because already you've been told that you don't have much information, so you should give that to her. You should give her the benefit of the doubt. Like, if she says nothing, something hasn't explained to has been explained to her. If she says that, why wasn't I given antibiotics, if she's under the impression that she could be high risk, then do something about that, isn't it?
Yeah.
So that was one way that you could have answered that question. And then after that, so you've offered for her to find out a couple of things. Offered her to find out what went wrong with the team. You've offered to find out whether there was any need for medication. So you should arrange a follow-up, right? It's like, how about I arrange a follow-up in a few days, where I could have a comprehensive idea about your case, and we can discuss this further, right? And then
Okay.
tell her a little bit about you know yeah, these are the rest of the points. Okay. And then tell her a little bit about some safety netting that you can give her to look out for any infection signs in the future, right? Any leaflets and pamphlets, how to keep the wound clean and prevent infection in the future. Yeah.
Okay. Yeah.
So safety netting you gave. Leaflets. Did you give leaflets? I'm not sure.
No, the time is running out.
I see. Yeah, I didn't mark these two. Yeah. So yeah. So yeah. So that would have been like the ideal picture.
Yeah. Okay. I understand now this case. Thank you.
Yeah. So angry patients will be angry. The point of view is not to satisfy them, is to understand the issue mainly. Like, why are they angry, and was there a mistake really made? Right? And if at all she's all that angry and all that, then offer her pals, right? And from your side, you can always say that I will consult with my seniors and my colleagues and find out if anything was wrong, and I'll try to implement it in the recent protocols. Because audit is also a big thing in the UK, right? So if you're actually hinting towards audit, they'll actually be impressed that, yeah, if there is any need for change, I mean, people are being proactive about it.
Okay. So basically, the angry patient will deal with as a similar the cases just to maintain whichever they are actually concerned. We need to address this concern. We need to validate their emotion, and the rest of the things is as similar, like we'll do everything, follow up, safety netting, and leaflet.
Absolutely. Yes, definitely. Because they're angry, right? Something was missed out in their care. So then definitely you'll have to do a follow up to make sure that, they are fine in the future, and this harm that has been caused on our account does not progress any further. Safety netting so that, this time they have a full idea about what is to be looked out for and how to manage their wound. And leaflets and pamphlets, definitely try to give it for everything, because you have leaflets for
Yeah.
everything. Yes. So yeah, that's like a given point.
Okay.
All right, Dr. Saida. Do you have any doubts, any questions?
No, actually, I don't have much idea about how to approach these cases, but now I got some idea. Thank you so much.
Oh, absolutely. I'm glad to help. Yeah, angry patient, you'll have to always keep validating their emotion. That's true. But also
So,
understand what angry. Like,
y-
what is that makes them angry? And try to, use that into your management.
and in all cases, we'll speak about, like, we'll involve senior, and also we'll investigate the case. And after this, once we like it's not medical error, but it be sort of misunderstanding. So we'll definitely find out where is the gap, and then
I
I'll
mean,
definitely speak up.
if the communication gap happened and nobody explained her about the complications, that is an error, right?
Okay,
I mean,
yeah,
all full instructions before you do the surgery. So yeah, I mean, that's what, no, you need to understand, assess how bad the error was, because this error caused her to have such a bad infection, right?
yeah,
That was kind of bad itself. So more than the surgery was successful and everything went fine, so the benefit of the surgery was barely anything compared to the harm that was caused.
yeah.
So that's not good. So yeah.
Okay, doctor. Thank you so much for the detailed explanation.
Absolutely, yes. And we hope that you take further mocks with us. And good luck for your exam.